Unit 1, Requirements for Maintaining Certification 2. If there are multiple ports on the tube, each port must be clearly labeled. Labeling can be accomplished by using the label already on the port or placing a label on the port with a permanent marker. Photographing the ports and labeling the parts, then placing with the MAR. Attaching a label to the ports. Anytime GJ tube is referenced in this curriculum, it refers to a stable and labeled gastrostomy-jejunostomy tube. Purpose of training. The purpose of this course is to provide DD personnel the educational basis to receive nursing delegation for feeding and medication administration per stable labeled gastrostomy-jejunostomy tubes, including understanding the equipment and procedure for feeding and medication administration per tube, the placement of GJ tubes, site care and maintenance of these tubes. MRDD personnel, feeding and administration of prescribed medication per stable labeled gastrostomy tube and stable labeled jejunostomy tube. As a result of the passage of SB 191, laws and rules governing delegated nursing in the state of Ohio have been significantly impacted. In response to these legislative changes, registered nurses who currently hold certification to train unlicensed developmental disabilities personnel to administer medication and perform health-related activities are required to receive updated information regarding the changes to law and rule and the subsequent revisions to training curriculum for the unlicensed person. In addition, the state-approved training curriculum for DD personnel is expanded to include instruction to unlicensed DD personnel in the care and treatment of individuals with feeding tube, including the administration of food and prescribed medication per gastrostomy or jejunostomy feeding tube, when such administration is properly delegated to certified DD personnel by a licensed nurse. The curriculum, which follows, provides training, information, and recommendations for certified registered nurse trainers of unlicensed DD personnel in the care and treatment of the individual with a feeding tube, including administration of food and prescribed medication per gastrostomy or jejunostomy feeding tube. Course objectives. 1. Identify the various kinds of enteral feeding tubes and their components. 2. Describe the internal and external placement of enteral feeding tubes. 3. Demonstrate the techniques for administering formula and medication. 4. Distinguish GJ tubes. 5. Describe how to respond to common complications and/or emergency situations. 6. Explain each point of the daily maintenance checklist for enteral feeding tubes. 7. Understand that prior to the licensed nurse delegating to certified DD personnel feeding or medication administration per GJ tube, the nurse must determine that the individual's condition is stable and the gastrostomy or jejunostomy tube is stable and labeled. DD personnel who will be receiving the delegation have had individual-specific training for administering feeding or medication to the patient receiving these procedures from the delegated DD personnel. Certification. 1. To obtain state certification, DD personnel must successfully complete this course, pass the course by A. Attending the entire program, participate in discussion and activities, and complete and submit an evaluation of this program to the instructor. B. Passing the course with an 80% score or better on a closed book test. C. Performing a successful return demonstration in administration of prescribed medications per GJ tube and administration of prescribed nutritional supplement per GJ tube, as well as the care and maintenance of the GJ tube and the insertion site. This includes resolving common complications associated with use of GJ tubes. Failure to pass the written test would require the DD personnel to retake the course in its entirety in order to retake the exam. Reminder: you must maintain Certification 1 to qualify for performance of tasks required of personnel with Certification 2, Administration of food and medication by stable labeled GJ tube. What happens if you fail to renew your certificate? 1. Should you not maintain Certification 2 due to lack of obtaining continuing education training, Certification 2 will be suspended for up to 60 days. During this time, you must complete at least 1 hour of continuing education. You may not administer food or medication per GJ tube while your Certification 2 is suspended. 2. Should you allow your Certification 2 suspension to go to day 61? Your Certification 2 is lapsed, and you will be required to re-enroll in the 4-hour Certification 2 course to regain your certification to administer medications and food per GJ tube. Maintaining certification. At least 8 weeks before your anniversary date, check with your supervisor about the procedure you should follow to renew your certificate. To renew your certificate, you must have 1 hour of approved continuing education on or before your renewal anniversary date. You must demonstrate competent skills related to feeding and medication administration per GJ tube. Failure to maintain a current certification in the administration of oral and topical medications and health-related activities, Cert 1, automatically disqualifies you from administering food or medications per GJ tube.